My name is Zoe Barber, and I'm a consultant oncoplastic breast surgeon and clinical specialty services director at Cwmtaf Meganog University Health Board in South Wales. So I decided to become a doctor when I was about 7. Both my parents were doctors, and I loved seeing the impact that they had on people's lives and the fact that they could help people. And for me, it was something that I always wanted to have the privilege of doing. I'm very much somebody who likes to fix things, and I really enjoy using my hands. So it seemed really natural that I always wanted to be a surgeon. And briefly, I thought I might want to be a brain surgeon. And thank goodness I changed my mind and decided to be a breast surgeon. The reason I'm a breast surgeon is because breasts are so important and integral as to who we are and to how we feel as women. And when you have breast cancer, it's a terrifying period of time. And so to have the privilege of not only being able to treat people's breast cancer, but also help them to look and feel normal at the same time was something that was very important to me in my career. And I'm very lucky to say that I genuinely love my job and look forward to going to work every day. The most rewarding bit of my job is having the privilege of supporting people and meeting them at a really challenging and frightening and vulnerable period of time. So when I sit in breast clinic, I know that most people in the waiting room are terrified that they've got breast cancer. Fortunately, 9 out of 10 of them will have the good news from me the same day that they don't have breast cancer. And that's a fantastic thing to be able to do, to reassure people that they don't have breast cancer. For the people who do have breast cancer, I'm able to reassure them that the likelihood is not only will they survive their breast cancer, but after their breast cancer treatment, they will live and they will thrive and they will go back to a normal life, looking and feeling like a normal human being again. And sometimes when you're so frightened and you're in that acute moment where you are absolutely terrified of what the road ahead is, you can't see that. And my job is not just to look after your breast, but also to look after your mind as well, and to be able to reassure you and support you alongside my team during that journey. The best bit of all is in 2 or 5 or 10 years' time, after I've treated someone for breast cancer, is seeing them looking and feeling normal and delighted to be recovered. And yes, their lives are changed by breast cancer, but they've gone back to a life that they are enjoying without worrying about their breast cancer every day. I think my patients value a few things about my practice that is slightly different than some of my colleagues' work. The first and most important thing is for every patient, I listen. And I respect the fact that they're an individual whose needs and wants and wishes may be different to my own or may be different to the next patient that I see. And my job is to give them the time and space and my time to enable them to feel heard and have those fears and desires heard in a consultation with me. Whilst I'm in a room with that patient, they're the only person that I'm thinking about in that moment. And it's really important that they feel that they have my undivided attention at such a difficult time. I'm always completely honest, and anything that I know about a patient, I will tell them and they will know. And I think that's really important as part of a partnership in their care, is that they know that I will always be honest with them. My job is not to tell people what to do. It's not to tell people what treatment or what operation to have. It's to give people the information that they need to make the decision about what's best for them, because only they know what's best for them, not me as a doctor to tell them what to do. And so as part of that, the thing that I value most about my relationship with my patients is that we are a partnership and we're working together with the same goal of treating their breast cancer or improving the aesthetic look and feel of their breasts. And so together, hopefully, we'll do a better job of achieving that than we would working separately.